Effects of tobacco on health. Background. Tobacco is extracted from around 65 known species of the tobacco plant, of which the one that is grown commercially and widely as a source of tobacco is Nicotiana tabacum. Most of the tobacco from northern India and Afghanistan comes from the species Nicotiana rustica. The growing use of tobacco is a cause of great concern around the world due to its serious effects on health. Non-communicable diseases, NCDs, like ischemic heart diseases, cancers, diabetes, chronic respiratory diseases are the leading causes of death globally and associated with tobacco use. Available data from WHO demonstrate that 38 million people die each year from NCDs, of which nearly 85% of NCD deaths occur in low and middle income countries. 1 According to WHO statistics for 2010 in India, NCDs are estimated to account for 53% of all deaths. Of these deaths, cardiovascular diseases and diabetes are the most common causes of deaths in India. 2 This huge burden of NCDs can be attributed to increasing use of tobacco. Tobacco is a major risk factor for a number of diseases affecting all age groups. WHO data shows that tobacco uses kill nearly 6 million people in a year. Around 5 million of those deaths are the result of direct tobacco use, while more than 600,000 are the result of non-smokers being exposed to second-hand smoke. One person dies every 6 seconds due to tobacco. Up to half of current users will eventually die of a tobacco-related disease. The situation is equally bad in India, with estimated number of tobacco users being 274.9 million, where 163.7 million users of only smokeless tobacco, 68.9 million only smokers and 42.3 million users of both smoking and smokeless tobacco, as per Global Adult Tobacco Survey India, GATS. It means around 35% of adults, 47.9% males and 20.3% females, in India use tobacco in some form or the other. Use of smokeless tobacco is more prevalent in India, 21%. Composition of tobacco. Tobacco products contains around 5,000 toxic substances. 5 Most important and dangerous constituents are nicotine, carbon monoxide, tar. Nicotine is the major cause of the predominant behavioral effects of tobacco. It is a poisonous substance, leads to addiction. Nicotine influences and reinforces all tobacco use behavior. After absorption, nicotine travels rapidly to the brain, in a matter of seconds. Therefore, the psychoactive rewards associated with smoking occur quickly, and these rewards are highly reinforced. Nicotine binds to the receptors in the brain, where it influences the cerebral metabolism. Nicotine is then distributed throughout the body, mostly to skeletal muscles. Development of tolerance to its own actions is similar to that produced by other addictive drugs. Carbon monoxide reduces the amount of oxygen blood can carry and causes shortness of breath. Tar is a sticky residue which contains benzopyrene, one of the deadliest cancer-causing agents known. Other compounds are carbon dioxide, nitrogen oxides, ammonia, volatile nitrosamines, hydrogen cyanide, volatile sulfur-containing compounds, volatile hydrocarbons, alcohols, aldehydes, and ketones. Some of these compounds are known to cause cancers of various organs of the body. Mechanism of action. Nicotine has structural similarity to a body neurotransmitter acetylcholine, ACH, which conveys information from one neuron to another. Acetylcholine is an important neurotransmitter involved in systems concerned with mental and physical arousal, learning and memory, and several aspects of emotion. There are also other receptors for acetylcholine in the body, apart from the ones at synapses. They are also found at the junction of nerve and muscles and nerves and certain glands. Acetylcholine receptors throughout the body are traditionally classified as nicotine receptors, those that respond to nicotine, and muscarine receptors, those that respond to muscarine. The ability of nicotine to combine with acetylcholine receptors means that it can exert actions like acetylcholine at all synapses where nicotine acetylcholine receptors, NACRs, are present and can trigger impulses. Forms of tobacco intake. Cigarette, most common and most harmful. Bidi. Cigar. Hookah, hubble bubble. Shisha. Tobacco chewing. Creeps, clove cigarettes. Snuff moist and dry. E-cigarette recent intruder in the list. When non-smokers are exposed to smoke containing nicotine and toxic chemicals emitted by smokers, it is called passive smoking or exposure to second-hand smoke. Risk factors for tobacco initiation. Following factors influence the predilection for tobacco use. 1. Biological. Developmental aspects of adolescent age group include a. Establishing independence and autonomy, b. Forming a coherent self-identity, and c. Adjusting to psychosocial changes associated with physical maturation. Gender. Tobacco use is more common among males. 2. Psychological. Low emotional stability and risk-taking behavior are more common in tobacco users. Existence of some mental disorders also increases the risk of tobacco use. 3. Social and environmental. Parental influence, lower education status, attraction towards role models, cultural practices, etc. Consequences of tobacco use. Various effects of tobacco use are as follows: economic loss, health loss, environmental loss. Tobacco is considered as a major behavioral risk factor for non-communicable diseases, one of the leading causes of death. Treatment of cardiovascular diseases and cancer imposes maximum financial burden on the individual and family. For cultivation of tobacco, crop forests are destroyed. Burning of tobacco produces number of toxicants in environment. Manufacturing, packaging and transportation also cause environmental pollution. Cancers associated with tobacco. Tobacco is also associated with cancer of respiratory tract, lung, upper gastrointestinal tract, liver, pancreas, kidney, urinary bladder, oral cavity, nasal cavity, cervix, etc. Smokeless tobacco, chew tobacco, snuff, etc., is a major cause of cancer of the oral cavity. Risk of developing cancer increases with duration of use of tobacco. Number of tobacco product use per day. Degree of inhalation. Cardiovascular diseases. Stroke is vascular disease of the brain where tobacco causes either constrict of blood vessels or rupture leading to loss of consciousness and paralysis. Tobacco affects coronary vessels of the heart leading decrease of blood supply or death of heart muscles, which is known as ischemic or coronary heart disease. This in turn causes cardiac arrest. Smoking acts synergistically with other risk factors like high cholesterol and blood pressure to increase the risk of coronary heart diseases, CHD. Respiratory diseases. Chronic obstructive pulmonary disease, it includes chronic bronchitis and emphysema. Asthma. Smoking is associated with acute attacks of asthma. Tuberculosis effect on pregnancy and its outcome. Bleeding during pregnancy. Ectopic pregnancy. Miscarriage/abortion. Premature delivery of baby. Stillbirth. Abnormalities of the placenta. Effects on newborns and childhood. Maternal tobacco use during pregnancy and exposure of child to second-hand smoke in childhood is known to be a risk factor for following conditions. Maternal smoking is associated with congenital malformations in baby like orofacial clefts, clubfoot, and atrial septal defects. Increased risk of allergies, higher blood pressure in childhood, increased likelihood of obesity, stunted growth, poorer lung function, increased likelihood of developing asthma. Miscellaneous. Following conditions are known to worsen if case of tobacco use. Rheumatologic conditions, rheumatoid arthritis. Kidney damage. Eye disease, age-related macular degeneration. Dental disease like caries. Diabetes. Inflammatory bowel diseases. Erectile dysfunction. Figure 1. Risks from smoking. Smoking can damage every part of the body. Therapy for tobacco cessation at the individual level. Therapy for tobacco cessation can be broadly classified into two types: A. Pharmacological and B. Non-pharmacological. A. Pharmacological. Nicotine replacement therapy. The general principle of nicotine replacement therapy is to present the patient with a safer and more therapeutically manageable form of the nicotine that directly alleviates the signs and symptoms of withdrawal and craving. Nicotine chewing gum is a very common method. There are other nicotine delivery systems available. Transdermal patches for delivery of nicotine through the skin. Nasal nicotine solution. Nicotine vapor inhalers, smokeless tobacco. Nicotine lozenge and sublingual tablets are also available as a form of nicotine replacement therapy. These devices increase quitting rates by approximately 1.5 to 2 times, regardless of setting. 2 other pharmacological therapies. It includes antidepressants and symptomatic treatment. Pharmacological strategies have a useful role in alleviating withdrawal symptoms. B. Behavioral treatment. There are a number of techniques which can be used to manage the cessation of tobacco use. Psychoeducation is providing information about the tobacco and its effects on human body. Discussing about the changes occur due to nicotine use are also informed to the user. This helps the patient to accept the corrective method. Aversion therapy. Aversion procedures involve pairing of smoking with unpleasant imagery scripts with electric shock, or with the unpleasant effects produced by smoking itself. These techniques are designed to create aversions to cigarette smoke, affective reactions characterized by distaste, disgust, fear, or displeasure. Such reactions reduce the incentive to smoke. Social support. Spouses of the smokers are also included in smoking cessation program to teach them how to be supportive of clients' quitting program. Treating the former tobacco users, preventing relapse to tobacco use. Effective relapse prevention treatment to all patients who have recently quit tobacco use needs to be provided. With the extraordinary high rate of relapse to smoking, patients' decision to quit needs to be reinforced, benefits of quitting are reviewed, and the residual problems arising out of quitting need to be resolved. Minimal relapse prevention consists of congratulating success, encouraging continued abstinence, and discussing with the patient the benefits of quitting, the problems encountered during quitting, and the anticipated challenges to staying abstinent.